Hello and welcome to Talk to Downtown. My name is Courtney Wood. I'm the Economic Development Director for the Downtown Stockton Alliance, the 501c6 nonprofit property-based business improvement district serving downtown Stockton. This series is intended to connect our business owners, property owners, visitors, and residents with the organizations, people, and resources which impact our community. Today we have special guest Fay Vieira. She is the Director of the San Joaquin County Behavioral Health Services Department. So I'm excited to talk with her today. We'll begin by having Fay share a little bit about her background and how it led to her being the director of the BHS. Then I will go through a list of questions I've outlined for her, and at the end we will open it up for viewer questions. So if you do have a question, please type it in as a comment and we will get to it towards the end of the live. And with that, welcome Fay. Thanks so much for being our guest. Please tell us a little bit about yourself and how you came to work for the Behavioral Health Services Department at the county.
Thank you, Courtney. I'm happy to be here today to share about San Joaquin County Behavioral Health Services. I started my career in San Joaquin County as a licensed marriage and family therapist. I actually started working for a community-based organization called Valley Community Counseling Services. And I worked there providing school-based therapy services to children. I started at Pittman Elementary School and Henry Elementary School, and then moved into the Tracy schools. I was the therapist at Jefferson School District under that contract for a while. I worked for Valley for 4 years, was very happy there. It's a great organization, but it is smaller than the county organization, and there wasn't a whole lot of opportunity for growth or promotions at the agency. So then I came to county, and I've been at county for 14 years in May, so a long time. And I started in their children's division doing hospital discharge planning for children that were in psychiatric facilities. And in addition to that, doing the 5150 psychiatric holds for children in San Joaquin County. So I travel to local ERs in our crisis center to do that. I found that I really had a heart for crisis services. Seeing people when they're not at their best and making sure that they get into the appropriate level of care so they can heal. And so I started volunteering my time to do overtime in the 24-hour services division. So I started working there, doing 5150 holds for adults as well, also clearing our crisis stabilization units and our psychiatric hospital alongside of psychiatrists when appropriate. And there I really deepened my understanding of what it means to have a severe mental health illness, and worked alongside of some really great psychiatrists that taught me everything I know about schizophrenia. And in that time, I also promoted. So I promoted to a supervisor and went out to Juvenile Justice Center in San Joaquin County to oversee the team of 11 that was out there providing mental health services to the youth in custody and doing discharge planning for them. So there I worked really closely with probation. I promoted to management, and then I went over to foster care. So I was the manager over all the foster care services for San Joaquin County. And at that time, I was sitting in the Human Service Agency building on the 3rd floor, so working closely with Chris Woods and his team. And then I promoted to Deputy Director over Children's and did that for a couple of years before I promoted to Clinical Assistant Director. I did that for exactly 1 year before I became the Interim Behavioral Health Director, and I've been the director officially since December 1st. So still relatively new in this role.
Congratulations on your promotion. And thank you for giving us your information on your background. Sounds like you have extensive experience in various areas of mental health and crisis. So thank you. Now, can you talk about what exactly is the mission of the San Joaquin County Behavioral Health Services Department? I don't know that everyone knows.
Mm-hmm. Sure. Well, it is on our website, but I'm not going to give you that version. I'm going to give you the version that really moves us every day. Our mission is to do what's in the best interest of our patients and our community. We are relentless about doing what's best for our patients. while at the same time honoring their voice and choice, because there is a thing called patient autonomy, and they do get a choice in how and where and when they receive services, and really honoring that for them, but also at the same time really making sure that their needs are being met. We serve those who have been historically underserved or marginalized. We're kind of like the provider of last resort for our community members when they need it. And we are really tasked with serving those with severe mental illness or severe substance use disorders. We partner with our managed care plans in San Joaquin County, and they're tasked with serving those with mild to moderate impairments. So when they have patients who need more than what they can provide, they refer them up to us, and we're happy to be there to provide those services.
Thank you. Thanks for giving that overview. And can you tell us how is this department funded?
Certainly. BHS has multiple funding streams. We are funded by 1991 realignment, which is really a tax, and it shifts responsibility and funding between the state of California back to the counties. So it puts money into the counties to provide services that the state had previously been providing. And we get a share of the state tax and the vehicle license fees to pay for behavioral health services. So when people complain about the price of their vehicle license fees, I'm always like, that supports my team. So I don't complain about those. Also, we're funded by 2011 realignment. That's similar, part of the state tax, part of the vehicle license fees. And that is a unique funding because it expanded our funding to allow for us to provide substance use disorder treatment in addition to mental health treatment. We're also funded with what is currently known as the Mental Health Services Act Fund, which is a 1% tax on California millionaires. However, Proposition 1 was voted in March of 2024, and that funding is now effective 7/1, will be called Behavioral Health Services Act. And the reason for the name change is Mental Health Services Act was strictly for mental health. We couldn't use it for SUD programs. And now starting 7/1, we can use it for both mental health and SUD. So we're funded by that. I do want to say that Proposition 1 did change our funding significantly. So while we're still getting the money, we are getting less because part of that money is now with the California Department of Public Health to do prevention rather than being at behavioral health. In addition to that, we now give the state 10% for oversight rather than the traditional 5%. And it does change the funding in those buckets. So we used to have a large bucket for services. So like services, you think of psychiatric services, case management, therapy. That bucket is much smaller now. And the bucket for us to provide housing for those with mental health disorders or substance use disorders is now much larger. So a lot of changes there. We're also funded by some grants, and then we also pull in revenue from the Medi-Cal services that we provide. So when we provide a service to someone, we bill Medi-Cal for that service, and we're able to pull in revenue for that. And we're kind of unique because I believe we might be the only county department that does not receive any county general funds.
Really?
Yeah, so we're self-sufficient.
Very cool. Thank you for talking about the multiple streams, of where you're getting your funding from. Very, very interesting. And now I'd like to ask, can you give us an overview of the mental health services that you do provide?
Sure.
Some of your programs.
Yes, so we provide mental health services to those who have a moderate to severe level of need. And we provide it at every level of care. So we do outreach, and we also do outpatient, and we do all the way up to inpatient psychiatric hospitalization and everything in between. So some in between, we do intensive outpatient, day treatment, residential services, crisis residential, crisis stabilization. So we have a lot of different levels of care to really provide what's needed at that moment for the person. We also serve all ages, so 0 all the way up to death. We serve every age, no one is turned away. And we're tasked with serving those with Medi-Cal or those who are uninsured. So we do not provide services to those with private insurance. unless they're accessing our mobile crisis response team. So we do have a mobile crisis response team that will serve anyone in need, regardless of their insurance status. And they can be reached at 209 468 2222. And when you think about mental health, the services I'm talking about is we provide case management, which is helping people get what they need, maybe linking them back to their primary care for something, maybe linking them to housing. We provide therapy, which is what most people think about when they think about mental health services. We also provide psychiatric services. We're really lucky in San Joaquin County. We have very gifted psychiatrists.
Thank you. Okay, that answers one of my questions I did have, which was who can access these services? So that's good to know. So you're helping people who don't have insurance, or you said they're on Medi-Cal. Unless someone's having a true crisis, then they can definitely use your crisis services.
Correct. And, even if someone has private insurance, they can call our access number and we will still help them. We know the tricks of how to get into your private insurance companies. Sometimes, when you call a private insurance company, they give you a list of providers, but no one calls back because they're full or whatever.
Exactly.
We know how to advocate with the private insurance companies to ask for a single fee agreement for someone who maybe isn't on the panel. We know how to do those things. So anyone can call us and we'll kind of guide them in the right direction for what health coverage they do have.
And what is that general line that they can call?
That is 209 468 9370.
Okay.
And that's a 24-hour number. Both of those numbers are answered 24 hours.
Oh, hold on one second. Okay. Let me type it up. 209 468?
Yep. 9370.
Thank you. 9370. Okay. So that's the general line that people are having some trouble. It's possible that your department could assist them getting the care that they need through their insurance somehow.
Right. And you don't have to worry about, I can't call that number because I think I just have a mild need. I'm not moderate to severe, because we are a no wrong door. So if you call us, we will screen you, ask it just a couple of questions. I think it's 7. And then if you do not meet our level of care, we do a warm handoff to get you to your managed care plan so that you can still get those services.
That's so nice, because it can be so frustrating, I'm sure, to call so many numbers and just get turned away. Well, that's not what we do. We can't help you. But that's great. So you're like, it's not us, but we're going to share with you who it is or connect you straight to that organization or person. That's so
right.
That's so great.
And we share the triage form too, so you don't get re-asked the same 7 questions.
Okay.
And the same works if someone calls their managed care plan. So if you call your managed care plan and they're like, this person needs San Joaquin County Behavioral Health, they'll do the same thing. They'll send us the triage form and they'll do that warm handoff as well.
That's awesome. Thank you. Mm-hmm. And so now you have the mental health aspect of what you do, which is huge. But you also have substance abuse services. So can you tell us now how you help with that?
Certainly. Well, we actually call it substance use services now.
Okay.
We dropped the AB.
Gotcha.
And it's kind of similar to mental health services. We'll provide services to those who are uninsured or have Medi-Cal, any age group, and we provide every level of care. So we do have outpatient services, we have group services, we have residential services, different levels of residential services. So if you need a safe place to live while you're getting clean and sober, we can provide that for you. We also have intensive outpatient, and we also provide medication-assisted treatment. So that is done by a psychiatrist, and that is when they prescribe medications to help people get clean and sober, and that can look like methadone treatment, or it can also look like buprenorphine. So we provide every level of care. And a unique fact about San Joaquin County is that we actually have 2 county-operated residential facilities. Most counties, they are all required to provide that level of care, but it's almost always contracted out. So we have contracted providers who provide that service for us, but we also have our own county ran facilities who do that. And one is perinatal. So we will even take women who are pregnant.
Wow. So that can be really helpful. If someone is needing to access those services, how can they, get in touch with you or your organization?
Same number, the 9370 number, same one. That is our access point of entry team, and they do the calls for people wanting mental health services and wanting substance use services. So same number. And what they'll do for substance use is they provide the ASAM, which is a standardized tool used throughout the nation, maybe even the world. And that tool determines what level of care you need.
Okay, thank you. In your experience, which services or programs are the most utilized in our county?
So it kind of depends by age group. So children, you will see that they typically use case management and therapy services. Only about 17% of our children who are getting specialty mental health services also have psychiatric services. And that just matches the philosophy that we should try psychosocial interventions first with children before we go straight to medications. But for adults, that's a little different. Adults, the services we see used most often are case management services. So that's like when we're trying to link them to things they need. Maybe they need to get to a food bank. Maybe we need to be talking to their primary care doctor because they have some complicated medical situations. We also provide psychiatry services at a higher rate to adults. And we also, at a high rate, provide medicated assistance treatment. And that is because it's not that everyone receives that service, but it is a daily service. So if you're on methadone or if you're on buprenorphine, those are things that you get daily. So it looks like there's a lot of services, but it's just that people who are on it get it every day. You don't get therapy every day.
Gotcha. Thank you. That's very interesting. And what would you say is the biggest mental health issue facing San Joaquin County right now?
So I'm going to break it down by children's and adults because it's different. But if you look at my data, now keep in mind, my data is for a behavioral health plan. So I'm looking at those with moderate to severe mental health issues. If you ask the managed care plan the same question, they might say something differently because they serve a mild to moderate population. So if you look at my data for adults, our most common diagnoses are psychosis, schizophrenia, and adjustment disorder. And when I dug down into what they meant by adjustment disorders, because there's different types, it's the one where it's a temporary response to a stressor or a trauma. Now, if you look at children, the most common diagnoses are a reaction to a severe stress, which is typically a diagnosis we give when we're not sure it's PTSD yet, or they haven't had it for the length of time to become PTSD yet. Number 2 diagnosis is PTSD. And number 3 for children is mood disorders. So when you ask about what is the biggest issue, if I look at the diagnosis, the biggest issue is traumatic events. We have too many traumatic events in our community, in our families. We need to find ways to make the community safer and to make our home safer. Because when you're looking at those numbers for children, the vast majority of their experiences are in the home. So something's amiss in the home. And so how do we decrease those stressors in the home? How do we make children feel valued and safe in their own home? And how do we decrease traumatic events in the community? To do that, we really need to build stronger parents. I do want to say I was a therapist at schools for 4 years. And when the parents wanted the therapy for their children, but they weren't at the table and involved, making progress was very difficult. The children who had parents who came to the table and actively participated in treatment, that's where we saw the meaningful change happen for those families and those children. So we work very closely with the child welfare team. We are stationed in the HSA building on the same floor as the child welfare social workers. And every time a child is removed from their home or might be removed, we get a referral and we start providing those services very quickly. We also we partner with HSA to provide wrap services to families. So what that is it's a service where HSA provides funding for a team to go in and really wrap around the family and meet every need they have, right? So maybe they're struggling because their fridge broke and they don't know how they're going to pay for that and how they're going to get food. We'll pay for the fridge. And then also we'll go in and we'll provide therapy services, case management services, and every month we come together and we have a good child family team meeting where we all sit down and we talk about how are things going, what are unmet needs, how can we still help this family. And we'll do that for families in every step of the process. Maybe they're at risk of having child welfare involvement, maybe they are involved in child welfare, or maybe they're stepping out of that. Maybe the parents just regained custody and we're helping them stay together as a family unit. So really looking at what can we do to make homes safer for families and children.
Beautiful. Yeah, that's just such important work. And if you can help them, when they're young and going through it, then hopefully they can become successful adults, once they've gotten past it and grown. Mm-hmm. So now I'd like to ask the same question about substance use. What do you see as the biggest substance use issue facing our county?
Sure. So again, if you look at my data, the data suggests that the biggest substance abuse issues for our county are opioid use and methamphetamine use. So what we are doing for those things is, one, we do a lot of Narcan distribution and education to prevent overdose. Narcan is an opioid antagonist and it's used to treat opioid overdoses, and it binds to the same receptors in the brain that the opioids attach to prevent them from attaching, to prevent death. So we do a lot of education on that. A lot of people think Narcan is a drug. It's not. It's relatively harmless. If you gave it to someone who you thought might be having an opioid overdose and they weren't, they would be fine. So we do a lot of education on that, and we do provide treatment for that, of course. One thing that we're uplifting right now for stimulant use, so methamphetamine and cocaine would fall into the stimulant use, is we are uplifting our first contingency management program. We're partnering with Dignity Health on that. They're a contracted provider who does that. And what that is, it's an evidence-based practice, and it's a treatment approach. And what it does is it rewards clean urine drug screens with gift cards.
Nice.
And it has been shown to not only reduce use and increase abstinence, but it has a lasting effect. So even after they're done with treatment, they're more likely to be abstinent than someone who didn't participate in the contingency management program. So we're working on that. We just started that contract last year and we're getting it up and running. There's some training you have to do and things like that because the gift cards are managed in a state system. So we just have to make sure we're doing it correctly and to fidelity when we're doing an evidence-based practice. And I'm just really excited about that.
Yeah, very cool. Forward thinking.
Yeah. Yes.
Thank you. In your experience, how do mental health, issues as well as substance use issues tie into the question of homelessness in our community?
Sure. Mental health and substance use and homelessness, they are tightly connected, but not in a simple causation kind of way. We can't really say which one came first and which one caused what. It's more of a cycle. Like you have to kind of think of it as a cycle where each one can lead to or worsen the other. So mental health issues can worsen homelessness, homelessness can worsen mental health issues, such and such. Many mental health conditions lead to functional impairments, meaning that they make it harder to obtain a job, retain a job. They make it harder for you to manage money, to remember when your bills are due, to remember where you put the checkbook, all those things. If you've ever been depressed, most people have experience some point in their life when they are depressed. It's kind of like everything you do, you have to do it with a wet blanket on, and it just makes it harder. It just makes it harder to do. So it's kind of like that. And when mental health is left untreated, that functional impairment goes up and it can lead to homelessness. And same with substance use. And when you're taking into consideration the high cost of rent and housing in California, it does not take much for someone to become financially unstable and then therefore lose their housing. When you're looking at somewhere where it's much more affordable to live, maybe Ohio, their rent's lower, so it takes a little bit longer for them to become unhoused. In California, it can be very, very fast because of how costly rent is. Additionally, being homeless can make any mental health or substance use disorders worse. With homelessness comes increased stress, increased chance of trauma, and decreased sleep. And sleep is so important when you're healing. And so, in addition to that, many who are homeless turn to substance use to cope. Maybe they're taking drugs to help them sleep at night because they're sleeping outside and they don't feel comfortable. So we can't say for certain that like they cause each other, but we can absolutely say that they interact with economic factors. So mental health and SUD, they interact with economic factors to get people stuck being unhoused.
Thank you. Thanks for kind of explaining that and seeing how they connect and kind of feed into each other in a negative way.
Absolutely.
I know, before we went live, you mentioned that the BHS does have housing services. Would you like to talk a little bit about that?
Sure. Yes. So San Joaquin County Behavioral Health Services has always used a lot of our realignment funding to provide housing for our clients who are some of our more severe patients. That has always been the case. With Proposition 1 changing, we will be using more of our money to provide more housing to more of our patients. And the school of thought behind that is that if you have a mental health issue and you're homeless, the mental health issue is always going to come second to addressing your housing needs. Like, where are you going to sleep tonight? It's going to be freezing tonight. Where are you going to sleep? So that's always going to get pushed off as not a priority when the housing is not addressed. So the idea is if we can get our patients in safe, stable housing, they can start focusing on their healing. They can make sure they're making it to their therapy appointments. They can take their medications. They can have a safe place to keep their medications so they're not stolen. So it's kind of like a housing first and then address all the other needs, right?
Thank you. Yeah, very, very interesting. And for someone to access those kind of housing services, do they need to be a client through one of your other programs already?
No, they can call our access number, and in that screening, we will screen for do they have safe and stable housing? And if they do qualify for our level of care and they need housing, we will do both simultaneously.
That's wonderful. That's such a nice thing to have access to, all in one place. So is there a message that you might want to share with anyone listening who is suffering from a mental health issue or substance use issue?
Yes. Call us now. Don't wait. If you think you might have a mental health issue or you might be struggling with a substance or you're on the fence of maybe I should stop using this drug, call us now. Mental health issues and substance abuse disorders are much easier to treat the earlier you get help. If you call us now when you're thinking maybe this is a problem, we might be able to get you back on your feet in like 16 weeks, right? But if you wait until it becomes a crisis or you hit bottom or you have a significant functional impairment, like you wait until it's so bad that you're homeless, you might be in treatment with us the rest of your life. So don't wait. Early intervention is key. Like I said, call us even if you have private insurance. We'll try to steer you in the right direction. And I kind of think of it like, think about it like losing weight, say,
True.
20 pounds over the holiday. It's much easier to start losing weight when you've only gained 20 pounds than it is to when you've gained 100 pounds. So don't wait until it's a crisis. Call us now and it will be much easier for us to assist you and much easier for you to participate and get something out of treatment.
Thank you. That's great advice. Hopefully, if anyone listening is having a mental health issue or you're struggling with substances, take that advice. Here's the number to get that help. Sooner rather than later. So it's here for you. There are services here. Thank you. What practical tips do you have for helping people to maintain a good mental health on a daily basis?
Okay, well, I'll talk about some things I do. Find a job with a boss you love.
That's a good one.
We spend so much time at work. If you hate your job, do something to change it. Get out, go somewhere else. If you hate your boss, go somewhere else. I am very fortunate to have the honor and privilege to work for Genevieve Valentine, and I have for many years in many different capacities. And when you have a boss who is kind and supportive and who you can turn to for support, like your quality of life just goes up big time. So step one, boss you love. I'm also a big fan of walking in the sun, getting that sun in every day, healthy habits, lifting weights, joining a gym, finding a gym partner. Also getting a dog. I'm a big supporter of a dog. If you can take care of them, they are a big responsibility. Those are just like the little things in life that you can do to improve the quality of your life. Also, there's a lot of research behind focusing on gratitude, doing daily gratitude exercises, counting your blessings. People who do that tend to have a positive outlook on life and are better able to handle those pitfalls when they come up, because they will, But, if you're someone who has a severe mental health issue, like I've said, most of our adult patients have a diagnosis of psychosis or schizophrenia. Those things will not be enough. You need to do those things, but you also need to come to your appointments. You need to talk to your doctors. You need to follow doctor's orders. You need to take your meds.
Thank you. Yeah. Thank you for those tips. That's good advice. You're so right. If you love your job, the rest of your life can have a nice little uplifting effect. But if you're having a tough time at your job, it can make the rest of your life really hard too.
Absolutely. No matter how good your coping skills are, there'll always be a ceiling to how far you can get.
Very true. And now I'd like to ask, what advice can you give to people who are maybe seeing a loved one struggle with mental health issues or substance use issues? Because that can be really hard.
It can be. It's I've talked to those families before, and I've heard their stories and listened to their pain, and it's very difficult when you have a loved one who you want to get into treatment and they don't want treatment. It's very frustrating. One thing, you can still call our access number. We can't give you any information about your family member that may or may not be getting treatment or falling in and out of treatment, but we can give you tips on how to engage them into treatment. Okay, so maybe if you call our access number and you tell us your story, we're going to say, you might want to consider doing a care court petition, and here's how you do that. Or it could be, have them call us, or something like that. Or maybe, it sounds like it's time for a mobile crisis referral. Let's help you with that, and let's respond. But also, there's something called NAMI, which is National Alliance on Mental Illness. Their acronym is NAMI, and people call it NAMI, and their website is www.nami.org. And they are an agency that was started by family members of people with mental health issues. And they kind of started a support group of how can we support each other? What did you learn about accessing the system that I can learn from you? And they have many programs for supporting family members in those situations. And they can really help navigate these systems of care. And they have online stuff and they have in-person stuff. They have an office in Stockton at our Railroad Square location at what people typically call the CalWorks building. So they're there and ready to help.
Thank you. That's really encouraging, to hear from people going through the same thing, families struggling. You really want to help, but there's only so much you can do, especially if someone's an adult.
Oh, yes.
But maybe this is a good avenue to get more support if you're someone who's going through that with a loved one.
Yeah,
Thank
and
you. That's really exciting.
they do have their annual walk coming up. I believe it's May 9th in Sacramento. And it's a fundraiser and a walk, and it's a great time to get to know them. And you can sign up through their website, but they do have their annual walk coming up on May 9th.
Very cool. Very cool. So you've talked about the fact that you guys serve pretty much everyone from, infants or, young toddlers all the way up to the end of life.
Mm-hmm.
And my question now is, who typically do you see benefiting from your services? Is there any data that you can share about that? Is it mostly that you're serving children? What can you say?
When it comes to children, the children who get better are the children who have parents who are actively involved in the treatment. That I can say for certain, that's been my experience. The children with the parents who come and want to learn different techniques for parenting, really want to absorb everything the therapist is saying, is supporting the child right alongside the therapist. Those are the children who we see graduate out of treatment. For adults, people who show up to their appointments and build a support system, they get better. So, for example, we have the Wellness Center in Stockton, and they have like a peer recovery support model where anyone from the community can drop in. They don't have to be a member, but many of our members do participate. And those people who are clients who surround themselves with other clients that have done well in our programs and build that support, they tend to be the ones that get better and stay better, in my opinion.
Very interesting. Okay, so you really do need that community behind you. You need someone else to turn to. It's harder to do it alone, sounds like.
Correct. Yeah.
All right. Is there anything that you think people would be surprised to know about the Behavioral Health Services Department?
Sure. In the most recent about 3-4 years, we have faced over 81 new initiatives or mandated changes.
Wow.
81. So, we have to be resilient and we have to pivot. And I joke, I've been in this in this agency for 14 years, but I still don't know everything because everything is evolving and changing faster than the speed of light, it feels like. So we are constantly having to completely change the way we do things to be in compliance with the new assembly bills, Senate bills, things like that. So, for example, we went through a payment reform and it completely changed the way we bill for our services, requiring different billing systems, requiring different electronic health records. And so that was a really big one. And that's just one of the examples, but 81 new initiatives and changes.
Wow, that must be quite a struggle to keep on top of that.
It's tiring for me.
Lots of coffee needed.
We have a great team, though. I have a great team. I couldn't do it without them.
And how does your work overlap with the work of the Human Services Agency? If you can talk a little bit about that.
Certainly. Human Service Agency, they are one of our biggest partners. We partner very closely with them. I spend a lot of time talking to Chris Woods and his team. Like I said, we are stationed in his building. So we have a team, I think it was 19 last I counted. We have a team of 19 behavioral health staff who sit amongst his staff for better integration. And we also have an MOU for that shared location. We also have 2 staff that are out at Mary Graham Children's Services. And so we have an MOU for that. So lots of work with them. Also, their eligibility workers are the ones that make sure our clients maintain their Medi-Cal insurance. So we work very closely with them, especially when someone's Medi-Cal insurance has lapsed and we're trying to make sure that they get the appropriate coverage so they can afford their behavioral health care. So we work closely with them as well. So really a seamless partnership. We also have an MOU with them regarding Assembly Bill 2083 on how we talk about shared patients. So how we talk about the foster youth that are also getting services with my team.
Interesting. So a lot of collaboration, working very closely to provide these services from both organizations.
Yes, that is correct. And that collaboration is mandatory based out of a lawsuit that came out of LA County, not San Joaquin County.
Oh, wow.
Called KDA. But to be honest, we collaborate with them anyways, even if it wasn't a mandate, 'cause it's the right thing to do and they're a pleasure to work with.
It just makes sense.
Yeah, it just makes sense.
So you mentioned earlier something called Care Court. Can you please talk a little bit about what Care Court is? How does it work and who is it benefiting?
Sure. So Care Court is a new mandate in the state of California. We went live with Care Court December 1st of 2024. And it is a civil court process that connects people with untreated schizophrenia or other psychotic disorders, such as bipolar with psychotic features, to community-based court-ordered treatment plans. So, and the goal of the program is to provide mental health services, medication, housing, and social services to prevent severe impairment, hospitalization, or incarceration. It is only for people 18 and up, and the petition has to come from a family member, a roommate, first responder, law enforcement, or a clinician. What happens then is a judge reviews the petition and can order a care plan for about 12 months. Ideally, the patient chooses to voluntarily participate in that. And if they don't, there's a chance a couple of things could happen. One, the judge could dismiss it altogether. Or two, they could become put on a conservatorship if they do not participate or make progress or get better. We've done 13 cases thus far. We've had 69 petitions. Not all of them pan out because sometimes we can't find the person. We do a lot of work to try to go out in the community and find them, but sometimes we can't find them. So we have 13 engaged in treatment right now, and we actually have our first graduation taking place this month. So
yay, congratulations. It's exciting. So does that mean all 13 are going through to this graduation?
Yeah, that's the goal, that all 13 will graduate. So we have 13 that agreed to participate and are working their care plans right now.
That's exciting. Since they're graduating, can you tell me just a little bit more about what does that mean for them? They've reached the end of the program, and what's the next step for them?
So that means that the judge will no longer oversee their treatment, but that doesn't mean that they'll stop their treatment. They are welcome to continue their care with us, and they likely will. They won't have to go to court for reviews all the time. So they'll still continue treatment with us, but maybe at a different level of care.
Thank you. Yeah, that's great news. Very exciting. Can you share any anecdotes about how the work that you've done has helped individuals? I'm sure you've seen a lot of stories, but are there any that you would like to share to demonstrate the impact that this work is having in our community?
Certainly. I mean, I could go on and on about this all day, but I have to make sure to protect the privacy of our patients, so I can't give too many details. I'll share two. There one time was a family that we had helped in the children's system of care, and they met their goals and did treatment. And then a couple years later, the family experienced something really traumatic in their home. And they didn't know what to do, and they were kind of lost. And they just packed up and walked to our office. And they just sat in the lobby. And they were sitting in the lobby, and they didn't really check in for an appointment. No one knew why they were there. But one of our parent partners who had worked with them before recognized them, was like, "Hey, how are you guys doing? It's nice to see you." And they told us what happened. And so we immediately got them all back linked into services and hooked up with providers that they needed. And why I tell that story is because that family had such a good outcome with us in the past that when something terrible happened, they didn't even know how to verbalize asking for help. They just walked to us, and that means that we did something right that first time, right? Like they knew they felt comfortable and supported, and they just showed up. And that's what I really want when we think about how the community thinks about behavioral health. I want them to think of us in that way. So I love that story.
Yeah.
Also, another one is we had a young lady who has very severe mental health issues, and we really having trouble. The family was having trouble getting her into services and getting medications right, and the family was actually going to start looking at alternative placements, like kicking her out.
Mm-hmm.
So sad. And we got her in with a really great psychiatrist, and he did a lot of close work on managing her meds and trying different combinations of meds. And we got her to be so much better that she is now doing well and has a part-time job and
Wow.
and maintaining her residence with her family. So she was looking at being homeless. And now she's able to maintain a relationship with her family, and she's in safe housing, and she's, working a little bit. And so we're just so happy to see that outcome. And when the right doctors with the right patient with the right medications, miracles can really happen. And the great thing about her is we got her when she was pretty young. And so, had we not, every time you have a psychotic break, there's more damage done to your brain. So we're
Oh, wow.
preventing those breaks from happening because we got her stable at such a young age.
Wow. Thank you for sharing those stories. Yeah. The first one, you're right. It's just, they just know where to go. They knew where to go. It's, we know we need help. We know where to go. We're just going to go there, and we know someone will help us. That's really beautiful. It's beautiful that they felt so safe and comfortable and knew where to be. And then the second story, you really changed her life. Her life could have gone in such a different direction if she had not been able to access services and there hadn't been such diligent work in finding what particularly worked for her.
Right. And,
Everyone's different.
and the family too. Could you imagine being a family and having to walk away from your daughter because of how difficult the behaviors have become and that grief that you would have had to live with? Like they get a second chance at having their daughter back.
Yeah, what beautiful stories. Really, really beautiful. What is one change that you think would make the biggest difference to the well-being of citizens here in San Joaquin County?
I put a lot of thought into this one. I can't think of a change, but what I can say is that we are very fortunate in San Joaquin County to have the Board of Supervisors that we currently have. Our supervisors, I go to every meeting because I have so many contracts. I always have something on the consent agenda. So that's where I am every other Tuesday if you need to find me. But I watch them and I can tell that they really care about the community. And the decisions they make are really grounded in what is best for our community members. And they do the same when they review my contracts for approval. And we're just, San Joaquin County, they're really fortunate to have this current group of supervisors. And with them making decisions for us, I'm sure that things are going to go really well in our county.
Awesome. So seeing that support from that level is really making it a big difference for the citizens of San Joaquin County. That's beautiful.
Yes, you said it wonderfully, Courtney.
In your own words, why is the work of the San Joaquin County Behavioral Health Services Department so important and needed in our community?
Yeah, if you think of what we do on a systems level, what we do reduces the burden on local hospitals, reduces the burden on law enforcement, and reduces the burden in jails. Because everything we do prevents hospitalizations, law enforcement involvement, and incarcerations. We keep vulnerable populations stable and reduce system-wide cost, and we directly positively impact community safety and quality of life. When we do that by providing those mental health services, the substance use services, our mobile crisis team, and assisting by providing housing with those who need it. Like that's how we do it. And it really reduces those overall costs and improves the quality of life.
That's so interesting to see it from that perspective, but you're so right. Yeah, you're catching people when they know they're struggling with something, they're having a difficulty, but it's like before they go and maybe happen to commit a crime, or before they're just so severe that they have to go to the emergency room, due to some kind of injury or something.
Exactly.
Very, very cool. Yeah, very needed. A place where they can go before they reach that kind of scenario. So you are the director now of this department, as you mentioned. And what are your goals for your time as a director of the BHS?
So my overall goal is to make sure that San Joaquin County is getting the best possible care, and how I'm going to measure that, because I do like things I can measure, which is kind of hard in therapy when things are touchy feely, right? But there's a couple ways we can do that. So one of those ways is our HEDIS measures. HEDIS is Healthcare Effectiveness Data and Information Set. And what it does is it uses Medi-Cal claims to look at what care is provided when. So I'll give you one brief example because I could talk about this all day and I don't want to bore people. Is that when a patient is seen in a hospital, an ED, an emergency department, and the primary reason they were brought in was a mental health diagnosis, they look at that person's Medi-Cal claiming data and look at when did we provide a follow-up service. And we provided a follow-up service if within 7 days you kind of get a gold star. And if you provide one within 30 days, you get a silver star. And if you don't provide one, But the unique thing about HEDIS measures, it is not just my BHS clients. It is every Medi-Cal beneficiary in San Joaquin County. So even if it's someone who has Medi-Cal, but I don't know about them. They're not on my open clients list. They've never touched our system of care. We still have to somehow know they went to the emergency department and provide them a service. So we are really collaborating with our health information exchanges, our hospitals, and our managed care plans on how do we get that data. So how, when someone with Medi-Cal goes to an ED and their primary diagnosis is a mental health or substance abuse, how do I get that alert? So now what happens is we get what's called an admission discharge transfer alert. So every time someone with Medi-Cal is admitted into like Dignity Health, Bamboo Health, or EHI sends us an alert so we can go see them. So right now we're trying to partner with Dignity Health. How can we do that? How can we get into your facility to provide that service before they leave? Because what we do know is when they leave and we call them, they don't answer. So
there you go.
That's just one example of a HEDIS measure. There are about 9 that we're held to right now, and they change every couple of years. But if we can meet the high performance level for every HEDIS measure, because they look at national averages and they give a minimum performance and a high performance. If we can, as a county, because it's not just behavioral health, like I said, the hospitals have to come to the table, the managed care plans have to come to the table. If we as San Joaquin County can come together and collaborate, so we're at that high performance level for all of our HEDIS measures, I will know that San Joaquin County is getting good services across the board. In addition, I would really like to see our jail become accredited by National Commission on Correctional Health Care. That's a thing that exists. I want to say there's only 9 facilities in the nation that are accredited, and it's going to be a long process, but we are really invested in working towards that accreditation. So not only our community members, but also our inmates are getting great care. And also this is something we're working towards now, but will likely be a long process as well, is we are working to become NCQA accredited at BHS, which is the National Committee for Quality Assurance. And what they do is they evaluate how well a healthcare system delivers safe, effective, and coordinated care. So we're working on an assessment right now to determine where we are in that process. And if we can do all 3 of those things, and I still have a lot of years left to work, I think we can do all 3 of those things, then I can retire knowing that San Joaquin County, if you're in San Joaquin County, you're getting really good treatment.
Gold star. Beautiful. I love those goals. And in this position that you have now, what is the most common question that you get asked, and how do you usually answer it?
So this question has changed over my different positions. Currently, the question I get asked the most is how can me as an agency get involved with behavioral health? And the best way to get involved with behavioral health is to keep an eye on the county solicitation page. So every time, we give an agency money or funding or contract with them, we typically have to go out to bid because we have to follow rules and procedures of how we give out public funds. And so I always encourage those community-based organizations or new agencies or agencies that are looking to get into our county to check out the county solicitations page. And you can find that by just Googling San Joaquin County solicitations. It comes right up.
Thank you. Thank you for that. And you talked about how there are so many changes that you're always trying to stay on top of. Are there any new programs or services that you'll be providing this year?
So many. So with Proposition 1, Proposition 1 not only changed our funding, but it also gave us 7 new mandates that we must implement. And they are evidence-based practices, meaning that in research previous to today, they've been found to be effective in meeting their outcome goals. So we are uplifting 3 evidence-based practices for the children's system of care. That one is parent-child interaction therapy, another one is functional family therapy, and another is multisystemic therapy. And those are actually going to go out to bid. They will be on the county solicitations webpage for a provider to provide those services for us. In addition, we are also implementing day treatment intensive services and day rehabilitation services. That is a program where it's kind of like a step down from hospitalization or diversion from hospitalization. So someone might come to that facility and spend 4 hours a day getting group therapy, individual therapy, collaborating with other people with similar issues, and being there for a long period of time to really get an intensive level of support for a short period of time. So we already have a provider who's doing that for us for children. It's brand new, and that is being done by Children's Home of Stockton. I think we have their first 2 patients starting any day now. And then we also are going out to bid for that for adults. That will be going out to bid very shortly for that adult program.
Thank you. Wow. Exciting new services. Hopefully they'll provide that extra layer of support and help for children and families. And my last question related to the work that you guys are doing particularly, or like overall, is about hiring. Do you have any positions or volunteer work that people can maybe pursue?
We can't do volunteer work just because of the complications with what we do is HIPAA protected and protected by 42 CFR. So everything is really private. So we don't have a lot of opportunities for volunteers. However, we are hiring. We do employ a large number of people. We are a great agency to work for. If you come work for me, chances are your boss will be a therapist, which having a therapist for a boss is great. They listen well and they're kind and understanding and patient. So if you're interested in looking for a position with behavioral health, you just Google San Joaquin County jobs and it pops right up. And you can look at the current openings. And if there's a position you want that's not currently open, if you open up the job description, there's a function at the top in the middle. It says interest card or notify me when this opens. If you click on that and you enter in your email address, it will email you every time that job opens for the next 365 days. So you don't have to remember to come back and check all the time. Yeah, you'll just automatically get that email. And you don't have to be a therapist to work for us. We hire people with some college units in psychology. So even if you're not done with your BA, you might need the MQs for a mental health specialist. We also hire people with lived experience. We call them behavioral health outreach workers. So, and you don't even have to have a degree or a high school diploma to do that. All you have to do is have some kind of lived experience, meaning that maybe you were a behavioral health consumer at some point. Maybe you have a family member who is a behavioral health consumer and you help them navigate our world. You would qualify for that position. And that position is very rewarding. You get to sit down with members and help them navigate our system and encourage them to come back and participate in treatment. People in that position are typically very happy. Also, if people are just interested in getting involved, but maybe they don't want to work for us or they already have a job, we do have a behavioral health advisory board. And we meet every Wednesday from 5 to 7. The location does rotate. So if you wanted to learn how you can get on that email distribution list, I'm going to give you a phone number. You ready?
Okay.
You can call Jasmine at 209-468-8255. 8753.
Okay.
And the public is welcome to attend those meetings, and we do accept public comment. In addition, we do have vacancies on that board. I think we have about 3. And so we do want community members to participate on that board. All you would have to do is look up, I think it's San Joaquin County Boards and Commissions. And you just Google that and it will take you to all the vacancies, and you would look for the Behavioral Health Advisory Board. And we need a TAY position. So TAY is Transitional Age Youth. We are desperately in need of someone who is 18 to 25 to join our board, and we're having a really hard time finding someone to fill that seat.
Wow, very cool.
The requirement is that you live in San Joaquin County.
Awesome. So you don't have to have experience necessarily with any of the services, but you do need to at least be a citizen of San Joaquin. No problem. Beautiful. How cool that people can get involved in that way, to be on the board, and that you're looking for a youth position, especially. Very cool. Thank you. Okay, so my last little grouping of questions is about Downtown Stockton. So the first one is, do any of your programs take place in Downtown Stockton currently?
Yes. Our main campus is, I call it Downtown Stockton adjacent. We're at 1212 North California Street. So we're at the corner of California and Harding. So that's where our main campus is. It's where our adult system of care is, our children's system of care, our justice services, and our 24-hour services. And we also contract with Main Street Youth and Family Services, and they're right in the middle of downtown. And we also have a team stationed at the HSA building and a team stationed at the Canalys building, which is also downtown.
Thank you. Awesome. And so obviously your services are countywide, but have you seen the BHS have an impact in Downtown Stockton specifically?
Certainly, yes. San Joaquin County has an SJ Cares program. People often think of it as probation, which is correct, but BHS has 2 members on that team. And we help with what I call compassionate encampment cleanups. So when there is going to be an encampment cleanup downtown, we go with the law enforcement officers and we offer, how can we help you find a new place to be? Have you heard about this shelter? Have you heard about this housing? You qualify for this. How can we get you there? You have a dog. Let's talk about how we can find housing with your dog, or where we can put your dog for now. So we do that downtown. Also, our mobile crisis response team does coordinate outreach in downtown with Stockton PD.
Thank you. Thank you for that info. And what do you love about Downtown Stockton, if you can share?
What I love about Downtown Stockton is the people and the vibes. Every time I'm downtown, I witness some sort of act of kindness. It could be someone just holding a door open for someone, or someone stopping so someone could cross the street. I've seen people share a cigarette before, and it just made the other person so happy. So there's just a lot of good vibes. Also, I enjoy the art murals on the walls.
100%. They're so beautiful. We have so many of them. And you're right. Yeah. On a daily basis, you could see a lot of people doing little kind things for each other. So very, very cool that you picked that one up. Mm-hmm. Do you have any favorite Downtown Stockton lunch spots that you would like to mention?
I honestly don't get a lot of time to take lunch, but I do like the London Fogs at Impresso.
Ooh, yes. Yeah. Love Impresso. Good shout out.
So wonderful drink. Well done there.
Definitely. Downtown staple. So how can people get in touch with you if they've got questions for you about anything you've said today, or they want to learn more about the services provided by the BHS, or just know more about what you guys offer? Sure. How can they do that?
Like I said, they can get involved with the Behavioral Health Advisory Board meetings. If they needed to reach me, are you ready? I'm going to give you a phone number.
Okay.
The phone number is 209-468-8357. And that's how they can reach me for information. But you can also call that access number that I gave out. That's a wonderful way to access and learn more about what we do as well.
Thank you. Well, thank you so much, Fay, for answering all of my questions. I learned so much about what you all are offering, what you provide to our community, and it's really important work that you're doing. So hats off to you and everyone on your staff. And at this time, I would just like to open it up to see if there are any audience questions. So if you do have a question, please type it in. And I think we have 2 so far. Are you ready for an audience questions?
Sure.
All right. Okay, first one, this is from Mike Huber, and this is on YouTube. So he says, the DSA community ambassadors interact with individuals that sometimes are having behavior issues on their patrols. Is there someone they can contact after hours for people in crisis?
Yes, absolutely. We have a crisis facility. San Joaquin County is kind of unique. Many counties don't have a crisis facility anymore, and those counties have to rely solely on their emergency departments. But we have a 24-hour crisis team, and they can be reached at 209-468-8686. Great question.
Yeah, thank you for your question, and thank you for the answer. So we've got the 24-hour crisis line. Perfect, good to know, just in case anyone ever needs it. Thank you. And then we've got one more question here. This is from Imperial Decree. They say, hey, Miss Vieira, what's your favorite CrossFit exercise? Is this the question you can answer?
I don't know the answer.
Okay.
Let's see. I'm partial to double unders, handstand push-ups, and bar muscle-ups.
Okay, there you go. Fun question. Thank you, Imperial Decree. Very cool. All right, so I don't see any more questions at the moment. So at this time, I would just like to remind everyone that this video has been streaming live. It's been streaming live to YouTube and LinkedIn, where we are at Downtown Stockton. It looks like the Facebook link didn't quite activate, so we're going to have to go back and share it there on our Facebook platform. Oh, it looks like we have one more question here that just popped up from Mike Huber. The question is, do the police have to make the referral for the crisis call?
No, absolutely not.
All right, so thank you for that. Okay, and before we close out, is there anything that you would like to share with viewers?
You know, I just want to say that I'm really fortunate to have an amazing group of staff that work with me. They make my job so much easier, and our staff at San Joaquin County Behavioral Health, they're our greatest asset. And we could not do what we do without them. So just a big shout out to them.
Beautiful. Yes. Thank you to your staff. And thank you, Fay, for your time today. I know you're very busy and you're so knowledgeable on what's going on here in terms of our mental health in the community, substance use in the community. I just want to say thank you so much for all of the time you've dedicated to helping San Joaquin County and for your time today. So I appreciate you.
Thank you so much, Courtney. It was nice to meet you.
Thank you. And thank you, viewers, for tuning in. And at this time, I'll just say, have a great day downtown. Thanks, everyone.